Hey everyone, Anna Hammonds here with Unite Ellis Podcast. Today we're hanging out with Kevin from Hope Health. We're talking all things health, how it works over there, an upcoming event they have going on. So let's get into it. All right, Kevin, thanks for coming. Why don't you get us started by telling us kind of your background, what you do at Hope Health, how all that works?
Yeah, so I'm the outreach coordinator. So it's my job to get the word out and connect with the community and the different agencies that we work with. And I started there in 2017.
Okay.
Worked there full time from 2017 to 21. I was outreach and enrollment during that time. So I had kind of dual responsibilities of kind of the marketing side, but also the enrollment side. So helping people become patients, helping people sign up for programs like Medicaid, SNAP, food stamps, marketplace health insurance, those kinds of resources. And I left in 2021 to take the weather business full time, and then came back in March of last year to just kind of on a part-time basis to really run the kind of the marketing and outreach operation over there.
Very cool. So anyone that doesn't know about Hope Health, give us the spiel. Let's talk about the service lines and everything that they do there.
Yeah, so we're a community health center. We're federally qualified as well. And so that means that we are able to provide affordable healthcare services regardless of your insurance status, your economic station. So if you have great health insurance, if you have Medicaid or Medicare, or you don't have any insurance at all, we are able to see you. And for those who do not have health insurance or may have health insurance with a really high deductible and low coverage, that kind of thing, who are low income, that sort of thing as well, we can provide health services to them. And we have a sliding scale discount as well. So if you're just depending on your income and your household size. So it's akin to really the federal poverty guidelines. If you've seen that, then you may qualify for those discounts that can make that healthcare more affordable to you. And we provide everything from just your primary doctor. I need a checkup. I'm not feeling too well. That kind of thing. Kind of your primary provider. We have women's health as well. And we have pediatrics. So whether you're an adult, really from birth to end of life, we cover everyone. And once you're an established patient, we also have dental services and behavioral health as well. We really focus on treating the whole person and providing those comprehensive services. So it can be a one-stop shop for an individual or even a family. I know my wife and my kids are patients there, and they can get their primary care and their dental and behavioral health services all in one spot. So you're not having to call multiple places to update insurance or get office A to fax to office B. We all know how difficult that can be sometimes. And so it makes more sense and more accessible to be in one place.
One thing I want to repeat that I heard you say that I think a lot of people may not quite comprehend. So full insurance can go there just like a regular, whatever you want to call that, doctor's office or whatever, versus no insurance or government assistance, all of that. It's everything.
It's everybody. And one of the things that also kind of sets us apart is we have multiple providers in our department. So a lot of the doctor's offices where it may be just one or two providers, sometimes it can take longer to get in just by virtue of there's just fewer providers there. And so we're usually able to get new patients in pretty quickly. And what I'll tell you too, is that we work the same way that most doctor's offices work. So we have a lot of people that will send in a registration, to become a patient, and they'll say, well, I'll call you when I need you. But what you have to remember is that first appointment to establish care, it takes a little longer because you're taking that time to get, those first labs done.
Set up.
You're getting to know the provider's getting to know you. That's a longer appointment. There's fewer of those in a day. So it's going to take longer to get in. Now, once you're in, once you're established, then you can have those shorter, those more acute appointments of, I have a concern, I'm not feeling well, I think I may need antibiotics or whatever the case is. Flu season, I need to get checked for 6 things to find out which one of them, flu or strep or cold or whatever the case is, right? So you definitely want to treat Hope Health as a as your primary doctor. And that's
Mm-hmm.
what we're there for. We
That's
want
really
to
cool.
be that medical home for
Yeah,
folks.
that's really neat. Okay, so on the women's services, does that include the prenatal side of everything? So it's really, start to finish, and then they have kids, everything. That's really neat. So I know y'all have a new building.
We do.
So what has that allowed y'all to do? I remember before the multiple spaces and so crammed. So how's that been a game changer for y'all?
It really has been a game changer. For one, our staff can park in a parking lot now. That's one of the biggest, crazy enough, right? That's one of the biggest differences that we have.
Yeah.
And so we were able to hire more providers. Now each department has a reception area. What's really, really nice about it is that on either side, the way the layout works, it's kind of mirrors on either side. Primary healthcare, adult health, and then pediatrics each have their own waiting area, and we can make those comfortable for each side. So on the adult side, it's quieter. There's not going to be kids running around, that sort of thing. And then the pediatric side, we can play some cartoons, get that kind of thing, have maybe some little STEM toys and that kind of thing, there. So we're able to tailor those areas for behavioral health and women's health. We're able to close the door and make those a little more private. I really, really like that. And then, we have a nice front lobby. So if you're not waiting for one of those services, you can be just in that general area as well.
Neat.
And we're not cramping 2 or 3 services worth of waiting into those 2 very small waiting areas we had before. We also were able to bring in new technology. In fact, just the other day, I was filming one of our dental providers for a feature we were doing for some of our social media content. And I was doing some B-roll, and I said, okay, well, look at something visually, nice on the computer screen. And he pulled up this 3D, basically mock-up of someone's jaw, of their teeth.
Oh, wow.
And I had never seen that before. And I mean, just when you think about where Hope Health, of course, formerly known as Hope Clinic, has been before, and where we are now, I mean, we have, we're state-of-the-art. And so you even think about these folks who are uninsured or underinsured, cash pay, that kind of thing. A lot of the time, unfortunately, they struggle to get great care just in the medical field in general. We're able to give them top-notch, state-of-the-art care, right there at Hope. So, and then for the insured folks, you can expect the same level of care you would get at any other facility.
That's great. Let's talk about, you mentioned on the enrollment side. So people coming in, it's even more so than just the medical side. So you mentioned enrollment in the government assistance. What all does that include of what they're getting help with there?
So, and that's open to the community. That's not just for patients. So important to point that out. But I mean, we have, the ability, the connections and the training to help them work through those applications. And one of the things that really can make a difference is knowing what certain words mean on those applications.
Oh, they're so confusing.
Because, for example, a household, it has a different definition for the Medicaid application than the SNAP application. It's on the same website. And the state of Texas has made it nice because through the website that they use, you can apply for multiple things through one portal. But at the same time, again, you're looking at whether it's Medicaid for children or CHIP, pregnancy Medicaid or SNAP or TANF, any of those programs, all those acronyms, right? The alphabet soup. So these different programs, it can be confusing. Well, what are they? Okay, they're asking for these pay stubs, but what are they really looking at? Like, how many do they need? And I mean, you can imagine one person applying is one of many. And so, we kind of know sometimes, depending on your situation, whether a paper application might be better or doing it online. Not everybody has access to the greatest internet speeds and reliability, that kind of thing. And so we're trained to be able to tell you, okay, this is what they're looking for here. This is what they're looking for here. If you don't have all the documentation, a lot of the time you're going to get rejected for that. So there are a lot of people that are getting rejected for services they qualify for, but they're not doing it the way they technically want it to be. And, the health insurance marketplace too, it can be confusing, especially when you finish the application, you've got this 4 pages of insurance plans. It's like, what does all this mean? People may not be familiar with what a deductible means and how does your deductible compare to your out-of-pocket, maximum and those kind of things. And so we're able to help put those things in common terms, make it more understandable, and then help you understand how your specific situation might fit with those programs. Because the way the state of Texas set these things up, they kind of want you to be a perfect little nuclear family and to make sense in one particular way. That doesn't always happen in a low-income community. And so we kind of help to figure out, here's your situation, here's how that fits with this application. Let's make sure that they understand your situation so that you get approved for what you qualify for.
Let's talk about the reason we even need Hope Health in the first place. So what are you seeing in our county, in our world, whatever, that Hope Health is meeting the need of?
Well, Texas is pretty high on the list of uninsured states. And I mean, we have a lot of people that are on Medicaid. When you look at the qualifications for adults with children to get Medicaid, it's even tighter. It's not as accessible. The healthcare world is getting more and more complex, and there's multiple reasons for that. But healthcare is just getting harder and harder to find. And I mean, I've seen, I couldn't quote one particular place or another, but I know that I've seen more and more facilities and providers that you start getting letters close to the fall or the end of the year saying, hey, we're not sure if we're going to take this insurance next year because those negotiations are getting more complicated. And so it's feeling less accessible. And I can personally tell you that it wasn't very long ago when I was sitting there cold calling places saying, hey, do you take this insurance plan or not? I mean, you sit down and you think about under Blue Cross Blue Shield or United or Aetna or one of these places. I mean, there's hundreds of plans under that. So then you got to figure out, get that over to the receptionist there. They got to check, and it's just a really, really complicated process. And that's the people that have insurance. Many don't. And I know that there are a lot of employers where you put yourself on health insurance, it's cheap or even free. As soon as you add a family member, that's a whole other deal. I had a case of, I think they settled on, it was either myocarditis or pericarditis. Honestly, it was like different documents, so I'm not sure which one they landed on, but I had a bit of a health scare and it was in between insurances. My wife had insurance. My kids were covered. I wasn't, just because of the way things fell. And of course, during that short window, that's when I have the health issue, right? That's just the way my luck works. But so I got a little bit of a touch of what that's like, where insurance doesn't always work to cover the whole family like it used to. Sometimes you have mixed status depending on where you are in the family. And I, as a dad, I know that my focus is taking care of, and I think this is a man thing too. I'm focused on taking care of my wife and kids, right? I'm focused on, I don't think about myself, getting myself taken care of. I'm making sure that they're covered. And men also don't like to go to the doctor. I will admit it. I don't have any problem with that, right? And so I just wasn't as proactive with that. And I see that a lot too. So the cool thing about Hope Health is that we take everybody. If the family is in different situations, depending on who has insurance, who doesn't, those kinds of things, we can see them. And then, if your job changes, or even if you lose your job, something like that, those kinds of changes, we can still continue to see you because we're not going to say, well, we don't take that insurance, so good luck finding somebody else. Because we take most, if not all, commercial health insurances, and we take Medicaid, Medicare, and cash pay, those changes are not going to uproot your healthcare. It's not going to uproot your care team there at Hope. So we can be a kind of a steady resource throughout those big changes in life. And that's really hard to find.
I love that. In your role as in outreach, are there themes that you're hearing when you're out and about in the community of needs that people are bringing up? What are you hearing as kind of a consistent thing across Ellis County?
Well, one of the things that I hear is just frustration with if providers, different private practices, those kind of things, if they're taking new patients,
Right.
they're so far, they're booked
The
so
wait
far out.
list. Yeah.
It's just insane. And it's like, people just kind of give up
Yeah.
because they're going, well, by then, I don't even know what's going to, I may go to the ER a couple of times
Yeah.
before that point.
Yeah.
Because there are so many chronic conditions we have that need maintenance.
Yeah.
And so I hear people are frustrated with that. Like I say, because we have more providers, our wait is not near,
Good.
what that is. And I also hear people tell me that, well, I have insurance, so I can't go to Hope.
Yeah.
And that's not true.
You're like,
we can see you. In fact, I was just talking to a friend the other day who needs a follow-up from a hospital visit.
Huh.
And she said, well, I have insurance. I didn't think I could go there anymore. I said, nope, here's the link, get set up. And I mean, it's, I talked to another one that was in the process of finding a doctor.
Yeah.
And she said, I can't find anybody that takes my insurance. And I'm going, well, I can tell you that we do.
Yeah.
So I'm finding one by one, and that's always been what we've been known for, is helping those uninsured. Yeah. But now even people with insurance are having trouble getting into the doctor.
Yeah.
And we're more accessible.
Yeah.
And then people find out, well, I can do my behavioral health and my dental there too.
Yeah.
Like I have moms that tell me all the time, sign me up. I'm so tired of driving my kids and myself and my husband all over the Metroplex trying to get all these things taken care of. And then there's just also that people are involved in the what do we call it, the gig economy, where they may not have health insurance. I am a content creator myself. I get it. I don't have a corporation above me that provides healthcare, so I had to find that solution for myself. There are farmers who they don't really have a health insurance plan because they don't have that umbrella. They own their own business. They're running their own thing. And that's becoming more and more common. The job market is slowing down, according to a lot of my friends that are looking for work and not really able to find it.
Right.
And so, in fact, I have a story that can kind of illustrate some of that too. This was back probably around 2019, I want to say. I had a woman come into my office this is when I was working with, enrollment needs and that kind of thing. And she was very well dressed, and I don't judge anybody by their cover, but usually I can tell when they're walking in what situation I might be working with. And, she wanted to sign up for benefits. So I'm thinking, okay, this might be somebody who's advocating for a family member or a friend or something like that. Just my immediate thought process. So in my head, I start thinking, okay, let me try to remember the rules around that, and just kind of mentally preparing myself to provide whatever guidance I could.
Yeah.
And she tells me a story that I don't think I'll ever forget. And she was I think like a nursing director at a major hospital. I mean, she's making six figures, doing very well. And she left job A and had great pay, great benefits to take job B. And I think there was a space in between there. A lot of people will take a couple of weeks, kind of mentally take a break from the situation you're coming out of to kind of prepare yourself, those kinds of things, which is great. But somewhere in that lull, and to this day, I don't understand how this is possible, because it blows my mind. Job B evaporated. It was gone. And she was left with nothing. And she has kids. She has a mortgage. Like, she's got real life things she's got to pay for. And so she's crying in my office, but she's thinking, I never thought I'd have to sign up for this stuff. And I said, listen, this is what it's here for.
Wow.
These programs are here for those weird times in life where you just need a minute to collect things and figure things out.
Yeah.
And that's what Hope is here for too. I mean, we're here for, not only are we here to be a steady resource, but sometimes you just need a hand to hold while things are just blown out of the water.
Yes.
Right.
Wow.
And so I've seen people that they just can't seem to get ahead, and they're in the low income world, and they just cannot seem to rise above. And then I have people that they've been living the life, and all of a sudden things completely turn on their head. So to think that we're in a situation where everything's great and we think you got it made.
Yeah.
Never ever take any of that for granted,
Yeah.
and never be afraid to ask for help.
Yeah.
Because that's what we're there for.
That's really good.
You don't have to be so proud that you're not willing to look around and say, hey, I need a hand here.
Yeah. That's so good. And it's good to have a place to go in and not feel judged. And I feel like so much of that in our social services, everybody does such a good job of being like, hey, no judgment. We all have those phases, or hard times. So that's really good.
Yeah, you were talking about the new building. And one of the things I love the most about it is I feel like it really reflects not only the quality of care that we give, but the comfort and accessibility that we want to project and that we bring to the table.
Yeah.
Because over on Jefferson Street, those two temporary buildings, they were hard to get into.
Yeah.
And for a lot of our low-income patients, a lot of them have chronic health conditions that because they're low income, because they don't have health insurance, they've let those things progress.
Yeah.
So it gets harder to get around.
Yeah.
So in a place where we really need to be accessible as possible,
it
was hard to get in. I even talked to an older, elderly, former patient, and I hate to say former, but she said, your building is just so hard for me to get into with my wheelchair. And it killed me.
Yeah.
And we were 2 weeks from getting into the new building. I said, give us 2 weeks to get in.
Yeah.
Visit us, come back, please.
Yeah.
And see this new building. But it's just, you walk in, it's just more comfortable.
Yeah.
And in a place where so many people that are coming to us are on their last rope, they're exhausted, they're worn out, they've been trying to get an appointment with everybody else, they're trying to get through just basic health needs.
Yeah.
Like we all need a doctor. It's just a fact of life.
Yeah.
And so I'm really relieved that we have that space where we can be a consistent, steady boat, a steady ship for people. And when they come to us and they're on their last leg and they just are so worn out from the complexities of the healthcare system, we can be that steady ship, that calming, relaxing, confident space for them.
That's good. That's good. Is there a certain service line that you see at Hope Health that's most popular? Or like I think about behavioral health, and I imagine that's a huge need and probably busting at the seams. Like, are you seeing trends with the service lines like that?
Not necessarily. I mean, our primary services are health, right? So I mentioned, we're a patient-centered medical home, which means that our primary service is our healthcare. So whether you're going into adult health or pediatrics, being that primary care provider is our most forward service. And then once you're in for those, you get access to dental and behavioral health as well.
Yeah.
On the behavioral health side, something I didn't know for a few months when I started back in March is that we offer counseling, marriage counseling, trauma counseling, PTSD, for children when it comes to, school-related issues or those kinds of anxieties that kids, sometimes go through. We offer those things. And the coolest part about it, and this is something that I've heard from multiple behavioral health providers, is that having immediate access, and this is part of being under the same roof, having immediate access to the healthcare provider. It's all the same system, so they can see the notes, right? And it's no secret at all that our teeth and our behavioral health are the rest of it's all connected,
right?
Dental care is almost treated as cosmetic now, when really, I mean, it's connected to the rest of our body.
Yes.
A tooth abscess or an infection or something can very quickly turn into something that affects the rest of your body. So they have that warm handoff, right? Where they can say, well, you're having this pain that's bothering you. That's more of a health thing. Let's go over and talk to,
that's neat.
Or vice versa. Our primary care providers may see, okay, you're taking this pain medication and you're worried about dependency.
Right.
Let's go talk to somebody that might be able to help with that. Or, it's you're losing sleep. That's raising your anxiety. That's raising your cortisol, your stress levels, that kind of thing. Let's go talk to a behavioral health provider that can see you once a week and help you with that side of things.
Yeah.
So, I mean, it's whole healing.
I love
because one thing is almost definitely going to affect the other.
Yeah.
And instead of hey, here's a business card, good luck.
Right. And then you got to start the process
exactly.
over. Yeah.
You're already there. And so
Yeah.
that care team and so many of these behavioral health providers that were in private practice or at a place that only provided behavioral health, they tell me that having that access to a collaborative care team makes all the difference in their outcomes.
That's really cool.
It really, really does.
I love it. So back to school's coming up. Y'all have an event coming up. Let's talk about that. What's all the details on that?
So back to school, most of the schools in our area, the first weekend in August are having back to school events. We'll be out there talking to families, making sure they know that our services are there. Right now is when parents start thinking about, okay, do my kids need immunizations that are mandated by the school districts or sports physicals, those kinds of things. And we get the question a lot, can you just give my kid the shot and that's it? We do provide those to our patients, our existing patients, our established, I should say, patients. That's part of being a patient-centered medical home, right? And so you do need to be a patient there. But the cool thing is you get started with us in the summer, get that long appointment done before school starts, and you don't have to worry about getting them out of school and then the note and all that stuff. So get them started, in the summer. And that's going to get everything set so that during the school year, if they're sick, you've got a doctor to go to. Right, exactly. You've got a doctor to go to, get that quick thing done, and get them back in school. Because, if you get the flu, sometimes you're out for a week. And that really piles up. And that adds to their stress because they've got to get caught up.
Right.
And all these things. It just adds up. And missing work and everything. So it gets you ahead of the game there. But, the sports physicals and those things that are mandated by those schools, those are things that we can help with.
Right.
And those back to school events will be there because we want to make sure that, these families know, because I don't know if you've noticed or anything, but our area is exploding.
Oh, really?
It's just, the growth is just so nuts.
It's crazy.
I'm a Waxahachie boy. So, trying to drive through 287 and 77 at like 5 o'clock in the evening is just not I know all the back roads, I just don't even try.
Yes.
But all that to say that there's so many new people in our community that, getting started with a doctor here is not very easy.
Yeah.
So, that's one of the things that I love through the schools, because that's where you meet a lot of these new families that are moving in.
That's great.
And then, yes, we do have events coming up. So immediately following that, the first half of August is like Super Bowl time at Hope Health as far as marketing and that kind of thing. We have National Health Center Week. And so that is a national event to recognize community health centers.
Oh, cool.
A little bit of history here. The community health center movement actually started with LBJ. As part of his Great Society. And what he wanted to do was set up community health centers throughout the country, especially in rural areas. Your urban areas, you had doctors all over the place. Well, there were so many rural areas, especially back then, they may not have that access. And there are even community health centers and facilities like it that will open up in some completely remote area, and they may open up like once a month or once a week, and they have lines like out the door because that's the only provider those people have. So the community health center movement, we are partially federally funded as part of HRSA and CMS and that kind of thing. And so National Health Center Week not only gives us a chance to focus on advocating for why it's so important to continue funding and those kinds of things, but it also gives us a chance to recognize the difference that we're making in our communities, the importance of our staff, our patients, and everything we get to do. So it kind of gives us a chance to tell our story a little bit on a bigger scale. And what we're doing this year is on Monday, August 4th, we're going to have a kind of a mini health fair, if you will, just for the kids. So we're just going to focus on the kiddos that day. We'll have different things, and make sure you're following us on social media because we'll announce more details. And then Tuesday, Wednesday, Thursday will be a little bit more of kind of our internal celebrations, focusing on our staff and those stakeholders that support us so strongly. And then on Friday, we're going to have a big health fair where we will be inviting some of our nonprofit partners in the community. We're going to have the Moncrief bus out there. And the Moncrief bus, they provide free cancer screenings. So mammograms, that kind of thing. We have more information on that on social media as well. But we're going to be providing some free screenings and free services that day.
That's great.
So not only is it an opportunity to see our new building, which is in itself really, really cool, but it's a chance to get to know us a little bit better and get some free screenings. And through those events, a lot of the time people find out, oh, I got high blood pressure. I should probably do something about that. And so we'll be happy to help you become a patient at that point, and help people who may not monitor their health so closely recognize some of those signs that, hey, you need to get on top of this.
Right.
Because I feel like chronic health conditions are, I don't know statistics on that, but I feel like it's everywhere. It's almost like everybody has something about their health that they need to stay on top of.
Yeah, absolutely.
And so we help do that. And so these free screenings are a great way to kind of recognize those things and really force ourselves to recognize our own, sometimes our own health setbacks and that kind of thing. So it'll be a great opportunity, and we're going to have some treats and some perks there as well.
Like treats. That's good.
Yeah, exactly. So it'll be a fun day. It'll be a great day to connect with us and maybe some other resources in the community to make sure that everyone is aware of what is out there for them.
So Monday's kids, and then Friday, is it adults and kids, or mainly adults, or all of you?
Yeah, I mean, it's probably going to be focused a little more on adults, just in terms of what services are provided.
Okay.
But it's for everybody.
Okay,
I mean, we'll have something for everybody that week.
Awesome.
And we really are from youth to adult and everything in between. So we want to make sure that not only is everybody recognized, but everybody learns what services are available to them.
So one thing at Unite, we talk about human flourishing all the time, right at the top: physical health, mental health, vocational, spiritual, relational. Like it's the whole, all of the human flourishing, but physical health is a huge thing. So I love what y'all are doing. We want to see people thriving and flourishing in our community. So I really appreciate what y'all are doing. We'll make sure and list all the information that Kevin's talking about, the Hope Health information, the events coming up. Y'all reach out if you have any questions. Thanks for being with us today, and thank you for all that y'all do.
Absolutely.
Y'all have a great week.